Low back ache can happen because of various reasons. The number one thing that we do is bad posture. Bad posture. So if you look at people and in general as such, we tend to be in a very comfortable space, in a comfortable sitting posture, or when we are lying at our home, people who want to watch TV and all those stuff.
On the couch.
On the couch, you understand how these people are generally in a very bad posture.
Correct.
Okay. So not having a spine straight is actually a bad posture for the body. Okay. Having our spine straight and at the same time relaxed and comfortable has its own advantages to keep the spine straight, to have good circulation, to have good digestion, etc. But it's not possible all the time to keep your spine straight. That we totally understand, right? So you can't be in a straight spine position all the time. I have seen doctors and the so-called health influencers advising you to have a straight spine position all the time. All the time. But you have to understand that is not going to happen.
Correct.
Just
be more cautious about it.
Yes, so be more cautious about it. Even though you are in a sitting or lying down, make sure that you're comfortable, your spine is comfortable.
Correct.
Right? Not to have any twisted position which makes strain or sprain to your back would be great. Okay, that's number one mistake that we do. Second thing, I think we already discussed about the importance of hydration. The other thing is people who are engaged in activities of lifting weights. So this is applicable for gym goers. This is applicable for those people as a part of their occupation who have to lift heavy weights, right? So we have heard from a childhood, lift with your legs, not with your back.
Correct.
So this anecdote originated because lifting or putting more pressure on your back while lifting weights will actually give more pressure to your the joints of the vertebrae and can lead to a lot of trauma, including spondylolisthesis, which is where your disc slips over one another, or it can lead to compression fractures of the spine if you do it for long enough. So these are very common pathologies that you find in low backache, which could be avoided if we are mindful about the way that we lift objects or we exercise or we work out.
Okay. So basically, people who are going to the gym, what would you tell them? What is the right way? If they have to lift anyway, what is something they can, actually not do? Means.
So if you're somebody who is going to the gym for the first time,
correct,
or if you're not very experienced in deadlifting weights and everything, make sure you actually have the service of a trainer, which is very important.
Okay.
You follow or you have a mentor to actually correct you in your posture when you're going to a gym. Make sure the way that you lift weight is not actually putting too much pressure on your back, right? Too much stress on your back. It's very important to have to avoid injuries. So I would suggest that if you are somebody who is regularly gym going, make sure that you're doing it the right way. Have a mentor to correct your posture. And if you don't have a mentor as of now, get a trainer for at least once to make sure you're doing it
just so that you know what's the right thing to do.
There are other factors where Gen Z is more vulnerable. For example, intake of water is one thing. I cannot stress enough the importance of drinking water for the health of your back, right? Our spine is built with vertebrae and discs in between. When we call this disc, which you might have heard of, are actually cartilaginous structures. So cartilaginous structures are very soft and very rubbery. If you want to get a feel of it, you have to touch the end of your nose because it's made of a cartilage, right? It's kind of very rubbery, it's soft, and it's 80% water. So when you don't drink enough water, the discs get dehydrated. And because it gets dehydrated, it can go into desiccation or degeneration. Now, that is one of the main causes of low back ache in youngsters right now.
Correct.
Okay.
So, it's a very big shock for me, thinking about water and back pain, because it's something I can't even think of relates at a point. But that's a very wonderful point that you mentioned, that it's somewhere relevant to each other.
Yeah. And hydration is very important, not just for bone health. Yes, of course, for all the bodily functions, we are especially made of water. But, the discs need water to have their shape. They are very elastic in nature. They need to bend, twist, and according to our movement. So to keep its ability to move, it needs to retain its structure, for which water is very essential.